For Lisa Beltrande, making desserts with her 4-year-old twins isn't as sweet as it used to be. Lisa was recently diagnosed with celiac disease, forcing her to be careful about the food she eats and even handles.
The thought of never eating a ravioli or having an ice cream cone or an Oreo, to think that you're never going to have any of those things ever again is a bit daunting.
Celiac disease is the most prevalent genetic autoimmune disorder in the world, affecting as many as 1 in 100 people. It is the result of intolerance to gluten, a protein that is found in wheat, rye, and barley, a protein that in some people can damage the lining of the small intestine. Dr. Kieran Kelly runs the Celiac Disease Center at Beth Israel Deaconess Medical Center in Boston.
The older thinking was that celiac disease was something that affected young kids with terrible diarrhea and weight loss and failure to thrive. In actual fact, most people with celiac disease in the US are diagnosed as adults. The average age of diagnosis is 45, so it's not a childhood disease.
Common symptoms of celiac include bloating or gas, abdominal pain, and chronic diarrhea or constipation. But there are an array of symptoms that have become apparent in recent years, some not related to the digestive tract at all. Melinda Dennis, a celiac nutrition specialist at Beth Israel Deaconess, has managed her own celiac disease for more than 17 years.
For example, they may just be presenting with something like iron deficiency anemia or infertility that's unexplained, some sort of neurological disorder like ataxia or seizures. We're finding it in many, many disciplines all over the map, across the board, in all organs of the body.
This drawer is only for my gluten-free food.
The disease is lifelong. The only approved treatment, a gluten-free diet, much of which is rice, corn, or potato-based. To cut down on cross-contamination by the food she feeds the rest of her family, Lisa invested in a second toaster and separate utensils. Hers are red. She's also had to learn to avoid gluten in places that may be unexpected: toothpaste, soy sauce, even handling dog food. Most importantly, Lisa had to learn a whole new way to get the nutrients she needs.
The hardest part is finding the balance of proper nutrition. For example, fiber is not in any rice products. So I just found myself eating all day and not feeling full.
By adding foods like high-fiber, gluten-free grains, cereals, dried beans, and yogurt, Lisa can avoid overeating and putting on weight. Melinda says even among gluten-free foods, some are more nutritious than others. She stresses education can make a big difference.
The gluten-free diet requires a little bit more preparation, preparing ahead, taking food with you, making sure that you're safe in dining out situations, visiting families and friends.
While there are no medications yet to treat celiac disease, researchers, including those at Beth Israel Deaconess, are making progress. Soon there could be a pill patients take before a meal to protect them from small amounts of gluten, like before eating at a restaurant or in other situations.
There's also a substantial proportion of patients with celiac disease who do not respond fully to the gluten-free diet. That's at least 10%, and in some estimates it's over a quarter of patients.
For now, Lisa will stick to her gluten-free diet. She knows that will help her avoid any complications. Those with celiac disease have a greater risk of anemia, osteoporosis, even some cancers.
I'm really lucky to have a primary care doctor who added that level of blood work to my labs and, caught it right away.